I'm Greg Nardine, licensed massage therapist here at Healthy Ways Wellness Center in Brookfield, Connecticut. An increasing number of people nowadays are recognizing the many benefits of adding therapeutic massage to their self-care regimen. Understandably, when faced with a new and unfamiliar experience, some first-time clients get apprehensive about what to expect during a session or what might be expected of them. This video will give you a look at how a typical session might go and hopefully answer any questions you might have. Now keep in mind that depending on the goals or issues of any particular client, the techniques used and areas worked can vary quite a bit from session to session. So today we're looking mostly at the routine of the session, positioning of the client, draping what gets covered and uncovered, and things like that. Once you've booked your appointment, you will be emailed a packet which will contain a health history form for you to fill out. Now it's important for you to fill this out as thoroughly as you can because there can be some conditions which would affect the way that we can work, even if they're unrelated to the reason for your visit. Now keep in mind that these are medical documents and will be treated with the same confidentiality you would expect from a hospital or doctor's office. Once you've got these forms filled out, you're ready to go for your appointment. As you first come into Healthy Ways, you will end up at the front desk. Here you can turn in the forms that you filled out and head right off to the waiting area. And here we are in the waiting room. Today we have a new client who's been gracious enough to volunteer to help us with this video, and that's Heather. Greg.
Nice to meet you.
Nice to meet you. Did you need to use the restroom before we start?
No, I'm all set.
All right, so we'll head on into the treatment room. Once we're in the treatment room, we will go over any questions that I have on the medical history form and go over our goals for the session and for long term for our treatment plan. Once all that's squared away, I will instruct the client to get undressed to whatever their comfort level is. Now let me clarify by saying that even if you are completely undressed, there are certain areas such as genitals and breast tissue which never get uncovered during a massage. So if you could undress to your comfort level and get under the top sheet and the blanket, today we're going to start face down. And for illustration purposes for the video, if I could ask you to leave shorts on for today.
Okay.
All right, that's great. Do you have any questions about anything?
No, thank you.
All right, I'm going to step out and let you get set.
Thank you. All set.
Okay. Heather, how's the face cradle feeling?
Feels good.
Okay, great. I'm just going to put a bolster under your ankles. And we'll get started. So we'll start by showing the back drape first. Obviously, this is an area that gets a lot of work in massage. And we would undrape it like so. Now we can work the back. When we get down into working the hips, this is why I had Heather leave shorts on. If a client does leave shorts on, I would not expose the clothing and work directly on the clothing. I would keep the drape in place and do the work through the drape to keep the clothing from getting lotion, etc. on it. If Heather had not had shorts on, another way to work the hip area would be to fold out like so. Now we can work the muscles of the hip and keep the gluteal cleft covered, which needs to be covered at all times. Next, we will do a leg drape. Now there are several different ways that you can drape the leg. I'll show you one way now. I'll do something a little bit different later on. I will say about therapeutic massage that arms and legs and even head and neck do get moved around, sometimes a little, sometimes quite a bit. And I don't ever want you as a client to think that you should be doing something if I haven't asked you to. Right now I'm lifting Heather's leg to get this drape in place, and she didn't help me at all, which is great because it's keeping the muscles nice and loose. Tuck in right there, and now we can work the leg. Once we're finished, we undrape and move on to the next area. When we finish with the back of the body, it's time to turn over. So I will take the bolster out from under Heather's ankles. And I'm going to keep the sheet and blanket in place. Give her a little room to move. And now Heather, whenever you're ready, if you could slide down towards your feet so that your head ends up on the table and turn over onto your back. Fantastic. We get the bolster back in. And we're ready for side 2.